In today's episode, I'm going to show you how you can naturally support the treatment of gallstones. Before we start, please remember that the information shared in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor or healthcare provider before making any changes to your health routine. Where do gallstones even come from? Gallstones form when the components of bile start to solidify and build up in the gallbladder. This usually happens when the body has trouble properly eliminating cholesterol and bile acids. Now let's go over the factors that increase the risk of gallstones, because understanding what causes them can help you prevent new ones from forming, even if you're already dealing with them. First, age. This is the one factor we can't control. As we get older, the activity of the enzyme that helps break down cholesterol decreases, and that can unfortunately lead to gallstone formation. Second, being overweight or obese. Too much body fat means too much cholesterol in the bile, which can easily lead to stones. Third, hormonal imbalances, insulin resistance, high blood sugar, and issues with how the body handles fats can all raise the risk as well. Fourth, certain medications. For example, ceftriaxone, a common antibiotic used to treat urinary tract infections, or octreotide, a medication that slows down how quickly the gallbladder empties. When bile sits around too long, stones are more likely to form. Fifth, sluggish digestion. If your intestines are working too slowly, your body absorbs more substances, including one with a tricky name, hyodeoxycholic acid, that can contribute to gallstones. All right, so what can you do to help get rid of them? First, eat more fiber. Studies show that a high-fiber diet, especially from sources like wheat bran, can reduce the risk of gallstone formation. Fiber helps limit the absorption of cholesterol and that problematic acid we just mentioned. Second, get more vitamin C. Citrus fruits and leafy green vegetables, both rich in vitamin C, can help too. Recent research suggests that diets high in vitamin C may slow down the formation of gallstones. Third, lecithin. One study looked into whether lecithin could help dissolve gallstones. The results were promising, making it a valuable option for natural treatment. In one experiment, researchers combined 220 milligrams of lecithin with 750 milligrams of ursodeoxycholic acid and administered it over 6 months. The outcome was impressive. About 80% of the gallstones were dissolved. In another study, participants took 1,200 milligrams of lecithin daily for 6 months, and about 50% of the stones were dissolved. That shows just how effective this compound can be. Fourth, dandelion root. Dandelion is a well-known herb in natural medicine, often used to treat inflammation of the gallbladder. But there's another major benefit. It can help prevent new stones from forming. It improves bile flow and helps prevent it from stagnating in the bile ducts. Additionally, recent studies have shown a link between heavy metals, such as cadmium, lead, and aluminum, and an increased risk of gallstone formation. These metals interfere with the enzymes responsible for properly processing cholesterol. Fifth, globe artichoke. This vegetable doesn't just taste great, it also supports liver and gallbladder health. Artichoke improves the composition of bile, which helps lower the chance of stones forming. Sixth, turmeric and other spices. Turmeric acts as a natural booster for cholesterol metabolism. It helps convert cholesterol into bile acids that your body can easily eliminate. Interestingly, other spices like capsaicin, found in chili peppers, ginger, black pepper, and cumin work in a similar way. They all help your body clear out excess cholesterol. Seventh, wild yam. This lesser-known herb is surprisingly effective. It contains natural compounds called saponins that help flush excess cholesterol out of the body through the stool. The result? Less cholesterol means a lower risk of gallstones. Eighth, boldo. Here's another herb worth knowing. Boldo is often used to support liver and gallbladder health, especially because it helps reduce damage caused by oxidative stress, essentially the wear and tear caused by free radicals in the body. Ninth, lifestyle changes. It might not sound like a magic cure, but regular physical activity and maintaining a healthy weight are crucial. Obesity and a sedentary lifestyle increase the risk of gallstones, so exercise should become a daily habit. However, it's important to avoid rapid weight loss or yo-yo dieting. These can actually make the problem worse. The key is steady, healthy weight management. Click subscribe and be part of a community of people who want to take their health into their own hands, naturally, wisely, and mindfully. Every week brings new tips that could transform how you feel.